Hello, and welcome to today's lecture on pulseless electrical activity, or PEA, focusing on the 5 H's and 5 T's. I'm sure you're excited to dive into this topic as it's essential knowledge for all nurses. Pulseless electrical activity, or PEA, is a clinical condition where a patient has an organized cardiac rhythm on the ECG, but there is no detectable pulse or blood pressure. In other words, their heart is producing electrical activity, but it's not effectively pumping blood to the rest of the body. Understanding the 5 H's and 5 T's is crucial for nurses because they represent the most common reversible causes of PEA. These causes can help guide our assessment, diagnosis, and treatment of patients experiencing PEA. In this lecture, we will explore each of the 5 H's and 5 T's in detail, discussing their clinical manifestations and nursing interventions. By the end of this lecture, you will have a solid understanding of these critical causes and be well equipped to provide the best possible care to your patients experiencing PEA. So grab your notepads and let's get started. These are the objectives for this presentation. You'll be able to define pulseless electrical activity, PEA, and explain its clinical significance. Identify the 5 H's and 5 T's as the most common reversible causes of PEA. Describe the clinical manifestations and potential causes associated with each of the 5 H's and 5 T's. Explain the importance of thorough clinical assessment, diagnostic tests, and interprofessional collaboration in identifying and managing the underlying cause of PEA. And discuss appropriate nursing interventions for each of the 5 H's and 5 T's and how they should be tailored to address the specific cause of PEA. Let's discuss the first set of reversible causes of PEA, the 5 H's. These 5 conditions are critical to consider when assessing and managing a patient with PEA. Let's dive into each one. Hypovolemia. This occurs when there is not enough fluid in the body to maintain adequate circulation. Causes can include severe dehydration, hemorrhage, or fluid loss from burns or vomiting. Clinically, you might see signs of shock, such as tachycardia, hypotension, and cool, clammy skin. As nurses, our interventions include assessing for signs of fluid loss, administering fluids as ordered, and monitoring the patient's response. Hypoxia. This refers to a lack of oxygen in the body tissues. Possible causes include airway obstruction, severe lung disease, or a pneumothorax. You may notice cyanosis, difficulty breathing, and altered mental status in patients with hypoxia. Interventions include ensuring a patent airway, administering supplemental oxygen, and monitoring the patient's oxygen saturation. Hydrogen ion, also called acidosis. Acidosis occurs when there is an imbalance in the body's acid-base status, leading to a buildup of hydrogen ions. Causes may include diabetic ketoacidosis, sepsis, or renal failure. Look for Kussmaul breathing, fruity breath odor, and changes in mental status. Interventions include monitoring blood gas levels, administering medications to correct the acid-base imbalance, and providing supportive care. Hyper or hypokalemia. These conditions refer to abnormally high or low potassium levels in the blood, which can impair normal heart function. Causes include renal failure, certain medications, or excessive potassium intake. Patients may present with muscle weakness, cardiac dysrhythmias, or changes in ECG findings. Nursing interventions include monitoring serum potassium levels, administering medications to correct the imbalance, and educating patients on appropriate dietary modifications. Hypothermia. Hypothermia occurs when the body's core temperature drops below the normal range, impairing normal organ function. Causes can include prolonged exposure to cold temperatures, wet clothing, or immersion in cold water. Signs of hypothermia include shivering, confusion, and generally speaking, a slow, weak pulse. But in this case, we have pulseless electrical activity, so there's no pulse at all. Interventions include warming the patient using blankets or warming devices, removing wet clothing, and providing warm fluids if the patient is conscious and able to swallow. In summary, the 5 H's are crucial reversible causes of PEA that we need to identify and manage to improve patient outcomes. Make sure to keep these conditions in mind when assessing patients with PEA and always be ready to intervene as needed. Now let's explore the second set of reversible causes of PEA, the 5 P's. These conditions are equally important to recognize and manage when encountering a patient with PEA. Let's discuss each one. Tension pneumothorax. This occurs when air accumulates in the pleural space, leading to increased pressure and collapse of the lung. Possible causes include a penetrating chest injury or a ruptured lung bleb. A lung bleb is a small collection of air between the lung and the outer surface of the lung, the visceral pleura, usually found in the upper lobe of the lung. When a bleb ruptures, the air escapes into the chest cavity, and that can be one of the causes of a pneumothorax, and that results in a collapsed lung. Symptoms include sudden chest pain, difficulty breathing, and asymmetrical chest expansion. Nursing interventions include monitoring the patient's respiratory status, administering oxygen, and assisting with needle decompression or chest tube insertion as needed. Tamponade, as in cardiac tamponade. Cardiac tamponade is the compression of the heart due to a buildup of fluid in the pericardial sac. Causes may include a penetrating chest injury, myocardial rupture, or pericarditis. Watch for signs like muffled heart sounds, distended neck veins, and hypotension. Interventions include monitoring vital signs, administering fluids as ordered, and assisting with pericardiocentesis if indicated. Toxins. Toxins such as drug overdoses or poisonings can lead to PEA by impairing normal cardiac function. Symptoms can vary widely depending on the specific toxin involved. As nurses, our role is to assess for signs of toxicity, administer antidotes as ordered, and provide supportive care. Thrombosis, pulmonary. Pulmonary embolism is the blockage of a pulmonary artery, often caused by a blood clot. Risk factors include immobility, recent surgery, or a history of deep vein thrombosis. Symptoms may include sudden shortness of breath, chest pain, and tachycardia. Nursing interventions include administering oxygen, monitoring vital signs, and administering anticoagulants or thrombolytics as ordered. Thrombosis, coronary. So, a coronary thrombosis, such as a myocardial infarction, can lead to PEA by damaging the heart muscle. Risk factors include smoking, high blood pressure, or a family history of heart disease. Symptoms include chest pain, shortness of breath, and diaphoresis. Interventions include administering oxygen, monitoring vital signs, and administering medications such as nitroglycerin, aspirin, or thrombolytics as ordered. So now that we've covered the 5 H's and the 5 T's, let's talk about the importance of thorough clinical assessment in identifying the underlying cause of PEA. As nurses, We play a vital role in recognizing and managing these conditions, and our assessment skills are key to guiding appropriate interventions. A comprehensive assessment includes a detailed history, physical examination, and review of the patient's medical records. Be sure to consider the patient's risk factors, signs and symptoms, and any recent events or changes to their health status. Remember, this is a medical emergency, so while this does need to be thorough, it also needs to be quick. Diagnostic tests may be used to help confirm the suspected cause of PEA. Some common tests include an electrocardiogram or ECG to assess the heart's electrical activity, blood tests to check for electrolyte imbalances or markers of organ damage, and imaging studies such as chest x-rays or CT scans to visualize the chest and surrounding structures. Interprofessional collaboration is crucial in managing PEA, as it often requires the expertise of multiple healthcare providers. For example, a patient with a tension pneumothorax may require the intervention of a respiratory therapist, while a patient with a myocardial infarction may need a cardiologist's expertise. As nurses, we must work closely with our interdisciplinary team to ensure that the patient receives the best possible care. Remember, this has to be quick. Remember that accurate assessment and diagnosis are essential in identifying and addressing the underlying causes of PEA. Be diligent and quick in your assessments. Utilize diagnostic tests as needed and collaborate with your interdisciplinary team to optimize patient outcomes. If you experience this in the field, out in the emergency room, this is not something you're going to be handling alone. This is an all hands on deck issue. When you are more experienced, if you decide to go the route of emergency care, you have the opportunity to sit for what's called the TNCC, the Trauma Nurse Certification. And in that, you will definitely be trained to quickly assess for these causes. Now that we've covered assessment and diagnosis, let's discuss nursing interventions and management for patients experiencing PEA. As you know, the underlying cause of PEA varies depending on the specific H or T that is affecting the patient. Therefore, our interventions should be tailored to address the specific cause. For example, if hypovolemia is the issue, we should focus on fluid resuscitation. If the patient has a tension pneumothorax, we'll need to assist with needle decompression or chest tube insertion. So it's essential to quickly identify the root cause and implement appropriate interventions accordingly. In addition to individualized nursing interventions, we should also follow the Advanced Cardiovascular Life Support, or ACLS, guidelines for managing PEA. These guidelines provide a systematic approach to ensure that our patients receive the best possible care during a life-threatening emergency. If you decide to go into emergency management, you will need to familiarize yourself with these guidelines and be prepared to implement them when needed. It's crucial to emphasize the importance of ongoing monitoring and reassessment. As nurses, we must closely observe our patients for changes in their condition, evaluate the effectiveness of our interventions, and adjust our plan of care as needed. This ensures that our patients receive appropriate treatment and we maintain their safety throughout the entire course of their care. So remember, addressing the specific cause of PEA with tailored nursing interventions, following the ACLS guidelines, and continuously monitoring and reassessing our patients are all essential components of PEA management. By applying these principles in your nursing practice, you will be well equipped to care for patients experiencing this critical condition. As we wrap up this lecture on pulseless electrical activity, I want to emphasize the importance of understanding the 5 H's and the 5 T's in managing PEA. Remember, these categories represent the most common underlying reversible causes of PEA. And by being familiar with them, we can quickly identify potential issues and provide targeted interventions for our patients. Nurses play a critical role in assessing, diagnosing, and treating patients with PEA. Your ability to recognize the signs and symptoms associated with each of the 5 H's and 5 T's can be life-saving. Thorough clinical assessment, utilization of appropriate diagnostic tests, and close collaboration with the other healthcare professionals on your team are all essential components of effective PEA management.